Right. So, what I'm thinking is let's do the homework exercises first. And then after that, we will go back to the lecture. Because sometimes, if we have been to the future and if we come back from the future, life is a lot easier. So that's why let's go to the future. So we will start with so the question is, use the diagram above, at least, well, I should say use the X-ray above to answer the question.
Some of the concerns that the community had.
Sorry.
That's okay. Which letter indicate what is known in a growing juvenile as an epiphyseal plate? What is the answer?
Isn't it A?
A is. So
No, it's B.
Oh,
it's
yeah,
B.
yeah. I forgot it's the one in the
Yeah,
middle.
B.
A. Yeah.
B. Okay.
Yeah.
Thank you. That somebody said B. Yes. Thank you.
I got those ones mixed up.
B. Hey. So what is A then? What is A then? You can type it. I will check. I will look on the chat. Somebody answered. And
It's
sure.
this one's the epiphyse. The epiphyse,
Yeah,
the end of the bone. Yeah,
Yeah,
that's the one I was
epiphysis.
trying to say. I got the other one mixed
Yeah.
up.
So this is epiphysis is A, and this is what we call epiphyseal plate or physis. In other words, we call it physis as well to make it short. This is epiphysis, physis. What is C? It is a flare area of a long bone. Just type it if you want. C is metaphysis, metaphysis. That is for the long bone, which is from long bone, the parallel structure just became the flare. So flare. So C is the region for metaphysis. And what is this called? The shaft. Shaft is called I'm waiting for the answer. Shaft is called the diaphysis. Yeah, that is the length of the long bone in the middle, yeah, like long bone. So at the end of the long bones will become flare, and it is called metaphysis. And B is physis or epiphyseal plate, and A is epiphysis. So now we see this B, structure B, which is joining the A and C together. Therefore, hey, I can say this is a joint. So I can say this is B. B area is a joint area. Joint is a structure. It is not an organ. It is not it is a combination of two things together. That is a joint. And what is this joint called then? Now I'm going to change the question. It's very, very easy to change the question.
This is a carpal joint?
At carpal joint is the joint here. So let's say according to the I was trying to get, what do you call that? Synchondrosis, isn't it? That's from the joint lecture. So synchondrosis means fibrous joint is two bones are joined together by the fibrous tissue, isn't it? If you remember that. So I know this is bone lecture, but that's what I'm saying. Like I can easily change the answer with the same radiograph. So the fibrous joint, there are three types of joints in our body according to the structure. which are the fibrous joint, cartilaginous joint, and synovial joint. So fibrous joint is two bones are knitted together with the fibrous tissue. That is fibrous joint. Cartilaginous joint, two bones are fixed together with the cartilaginous tissue. And number three type of joint is synovial joint. Synovial joint has synovial characteristics. So now this is the cartilage. Therefore, on the X-ray, in an immature skeleton, let's say in a child, the bones are still growing, and this is the growth plate. We grow from this area. The cartilage will continue forming, and then the bone will get longer. And once the bone longer, the rest of the cartilage will get calcified, and then the bone become longer. That is the way we grow. That is the way we grow. And this is the growth plate, which is called physis. But at that time, the growth plate, which is the cartilage plate, is fixing two bones, epiphysis, which is the bony structure, which can be seen on the X-ray, and metaphysis, which is the bone structure. So again, on other words, it is a joint. And therefore, we can say this is a joint. That joint is cartilaginous joint because two bones are fused together by a cartilage. That is the cartilaginous joint. There are two types of cartilaginous joint in our body. Synchondrosis, which is this one, like the cartilage in the middle, two bone, or symphysis, pubic symphysis. Okay, I'm going to move on. So now, epiphysis. Now you know epiphysis is? Which letter is epiphysis?
A.
It's
A, yeah, A, yeah. So now we know A is epiphysis. Hey, now look at that. Look at that. Let's read it. I'm not sure why I put this just to show you something, so that if you look at it, you will start to remember some sort of bone, blood supply to the bone. So yep, so one question chat. Okay, A, yes, thank you. And now this diagram is showing the blood supply to a long bone, yeah? Long bone blood supply, like for any long bone in our body. And as you remember, we have a nutrient artery which goes into the bone from outside to inside. You can see, therefore, if you look at a long bone, in the middle part somewhere, you should be able to see a little foramen. That is for the blood vessel to go into the bone, and that is called nutrient foramen. And the artery going in and the vein coming out, they are called nutrient artery and vein. And now this artery will go deep into the medullary canal, go top, go bottom, and then give the blood supply from inside out. So this nutrient artery gives blood supply to the bone, to the cortex. Cortex is here, compact bone is cortex. Inside to that, interior to that of the cortex, we get blood supply from the nutrient artery. And we have the outer covering of the bone, which we call periosteum. And that periosteum is also rich with blood vessels. Therefore, in kids, in children, this periosteum is very thick. So that's because they are still growing age, very thick periosteum. And this periosteum also gives blood supply to the compact bone, outer two-third. So inner two-third is from the nutrient artery, giving blood supply to inside out, and outer two-third, we got it from periosteum. Of course, if we get around to the metaphyseal region, here we said metaphysis. Metaphyseal region, we will have metaphyseal artery and vein. And for the epiphysis, which we talk about, we also have epiphyseal artery and vein. So there will be like little arteries and veins here and there in the epiphyseal region, metaphyseal region, but the whole segment, the diaphysis of the bone, is supplied by the nutrient artery. That's the blood supply for the bone. Now let's solve the problem here. The question is, use the diagram above to answer the following question. Which letter indicate the region of long bone that in adult is filled with the yellow bone marrow? Oh, where do we have our bone marrow?
In the middle of our bones.
In the middle, okay. Somebody answer as well. D. Aha, yes, correct answer, D. Because this is the medullary canal. So what is C then? If you translate this X-ray to this diagram, what is C?
Compact bone.
Compact bone, yes, it is a compact bone. Inner two-thirds of this compact bone, which we can see here, this is the thickness. Inner two-thirds is supplied by the nutrient artery. Outer one-third is supplied by the periosteal artery. And at the same time, metaphyseal region, we have metaphyseal artery. Epiphyseal region, we have epiphyseal artery.
Professor, could you explain the periosteum again?
Yeah, so periosteum is the fibrous layer, thickening. It has got two layers, inner periosteum and outer periosteum. So it just goes along the diaphysis of the long bones. So it is two layers. So two layers. So periosteum, we have two functions. So outer layer, outer periosteum, it is for resisting for stretching and something like that. Inner layer, because it is close to the bone, it has rich blood supply and it will give nutrition, blood supply to the compact bone. So in children, the periosteums are very thick because they are stay active and growing. But when we get to our age, the periosteum is just there. So so what is B? What is B? I am waiting for the answer. B is, what is the name of this little bump?
Is it the metaphysis?
Yeah, metaphyseal region. But it is a little bony bump here, and there is a bigger bump here. This is bigger bump, and this is lesser bump. What is that? It is smaller, so it is lesser. This is bigger, so greater. What do you call that? Greater? Greater trochanter. Yeah, it's greater trochanter. Trochanter means big bony bump. So any bony bump you can call trochanter, or small little bump you can call tuberosity, or small little pointing thing like spine. So this is a big bump, trochanter. I think there are only like just one or two term trochanter in the body. Yeah, if I can remember, only one, like greater trochanter is in the lateral aspect. If you poke your hip from the side, just below your trouser line, from the side, you should be able to feel the greater trochanter. It's such a big bony bump. Lesser trochanter is in the groin area. You won't be able to feel it. It is so difficult to feel. So what I would do is you stretch your thigh outwards. You spread your thigh, and you will see the tendon in the groin. And if you follow that tendon is going to insert on the lesser trochanter. Okay, so you got the answer right. I'm going to move on. Oh, what is that? Okay. Use the diagram above to answer the following question. Which letter indicates the space where microscopic blood vessels and nerve in the osteon can be found? Okay, somebody answer that question. A. In the space, yes, A. So what do we call this space A? The name of A, the name of B, the name of C, the name of D. I think I need to show you that diagram again from the bone lecture, because at that time, you know, it was quite a heavy lecture. You guys might not pick up. So A is the little canal. These are the cat section of the A. So inside the A, these are the neurovascular bundles. Yes, blood vessels. So inside the A, these are the tunnels, tunnel-like structures. These tunnels are called Havasian canal. Yeah, Havasian canal. And this one circular structure here, like an onion ring with the middle Havasian canal, it is called, B is called I am waiting for the answer. Someone answered it. Yay, thank you. Let me have a look. Osteon, that is correct answer, osteon. So B is osteon. Another name for osteon is Havasian system. Yeah, it is a system because it includes the canal and it includes the other parts. Therefore, B is osteon or B is Havasian system. The same. It is just like that is the functional unit of a compact bone. Compact bone. So that is the like periosteum here, which we saw here. We talk about it is just like something like a blanket which covers the body. It has two layers, inner periosteum and outer periosteum. Okay, so C is lamellae because it is going around the bone in a circumferential manner along the whole bone. Therefore, we will call circumferential lamellae. And D is, it is just around the osteon. Therefore, I will give it interstitial, interior, inside, interstitial lamellae. And C is circumferential lamellae. I know this diagram is a little bit complex. I will go to the lecture slide and we'll talk about that. So now you know circumferential lamellae, which is C, and did I ask? Interstitial lamellae, this will be D. Osteon is B. Oh. So can you see the difference between two pelvic X-rays? Can you tell me what are the big difference between two X-ray for the pelvis?
There seems to be a bigger space in the pubic bone area on the right.
On the right, you mean this one?
Below that. Yeah, right there.
One? Yeah. So that's what we call obturator foramen, OBTURATOR, obturator, OBTURATUR, obturator foramen. Yes, these are the obturator foramen, which is boundary by the superior pubic rami, inferior pubic rami, and pubic bone. And then if you go there, we have the ischium. And on top of that, what is the difference?
There's differences in how much bone mass the patient has.
Yeah, look at that, you know. On this X-ray, the bone has lots and lots of calcium. So therefore, the principle of the X-ray is a ray, which is called X, that pass through the body. And on the opposite side, we put the cassette tape to take the picture. So when the ray is going through the body tissue will impede the ray. And depending on how dense it is, if they are not dense, like air in the body, will not impede the X-ray. And therefore, this X-ray will change the X-ray film into black color. So when we do the X-ray and when the X-ray beam is crossing the bone, because bone is a solid structure, a lot of calcium in it. So therefore, these bones in our bodies will impede the ray which is passing through, and therefore less blackness on the X-ray. So therefore, the bones are white on the X-ray and the air is black on the X-ray. So now if you look at that, that is the, you know, thick white, very solid. It is too much for me. It is too much for me. And if you look at that, again, this X-ray is not normal, this bone quality. It is 2 liter calcium, 2 liter bone matrix, 2 liter bone, what you call the collagen fibers. This is a condition what we call osteoporosis. If you take a piece of this sort of bone and weight it, the bone mass is reduced. If you take the piece of bone from this type of X-ray, the bone is so heavy. So reduction in bone mass is called osteoporosis. And this is bone is too much, too thick, too many calcium. So that's the difference, you know, one is one extreme and the other is opposite extreme. So nothing is normal. Therefore, this patient has got broken neck of femur, like and neck of femur fracture, like elderly grannies, especially in women, especially in older age group, especially in more in like Caucasian people, osteoporosis more in common, more in those who are smoker, more who are less active, these sort of people. Now they got their bone quality is not good. And even with the minor injury, the neck of the femur is broken on this side and the bone is becoming detached from the head and the neck, the shaft, and therefore it is twisting around. So for us to have a normal quality bone, we need to have the osteoblast, which is the bone forming cell, and we need to have the osteoclast, C-L-A-S-T, clast, which is the bone removing cell. They need to work together. They need to balance together. If the osteoclasts are functioning too hard, we will get something like that. If the osteoclasts are too lazy, or if there is no osteoclast in our body, we will get a condition like this. This is what we call osteopetrosis. So you don't need to remember the name. I just show you the X-ray so that you are exposed to these. The patient has osteopetrosis. Osteopetrosis is this condition. The osteoclasts, you need to know osteoclasts. The osteoclasts are not functioning well, and the bone mass is so thick, so dense, and that is what you see on the X-ray. So now I answer the question, which bone cell is required for the bone resorption? Of course, it will be osteoclast. Yeah, osteoclast is for bone resorption. Bone building is osteoblast. Osteoblast and clast need to get balanced together. Long bone is able to withstand the compression and torsional force because, let's have a look. Within each osteon, we have the collagen fibers. So that means like collagen fibers and the mineral crystal in the adjacent lamellae in the deposit. So it is a long answer, but it is because of the the osteons and lamella, interstitial lamellae, circumferential lamellae, together with the bone mineralization, like because you put calcium phosphates in between the gap, and therefore the bone is strong enough to take your weight. If you are 60 kg, the bone weight have to take 60 kg. If you are 100 kg, the bone will have to take 100 kg of your weight. So again, like now, next, oh, where is that? So in intramembranous ossification, so how many ossification do we know in the body? So ossification means the bone formation, starting from little piece baby to become a human being. How many types of ossifications are there? So there are two types, yeah. One is intramembranous ossification, and the other type is endochondral ossification. Endochondral, chondra means cartilage, and endochondral ossification means there is a cartilage first, and then that cartilage is replaced. So the bones will come into the cartilage and finally replace the cartilage. That is the endochondral. Intramembranous ossification is the bone form starting with the bone. So the example is the bone in the skull bone, which is a flat bone, that is the intramembranous ossification. So the bone is formed directly from, of course, mesenchymal cell. You know, that's the origin. Mesenchymal cell just jump into the bone. It doesn't change into cartilage. So now you know the answer. In blank ossification, the bone formation starts with cartilage model and later replaced with bone. So what is that? What sort of ossification is it? Endochondral ossification, yes. So in endochondral ossification, endochondral means chondrite cartilage tissue form first, and membranous calcification from the basic human mesenchymal cell just jump into bone. And almost all the bones in our body are formed by endochondral ossification, except the skull bone and the collarbone, clavicle. So now this is a little bit expanded question. I just want to waste your time while reading a long paragraph question, which is nothing related to the proper question. So a motorcyclist involved in an accident was brought into emergency department. He had a broken fracture tibia, broken bone fracture tibia, and was treated with the initial debridement, external fixator for definitive treatment. The picture is shown. Now it is all clean and debrided. So what is the first stage of fracture healing?
Blood clotting. I forgot.
Yeah, blood clotting. That is what we call hematoma formation. So any bone, once any bone break, there will be bleeding from the periosteum. There will be bleeding from the cortex. There will be bleeding from the medullary canal, endosteum. And these vessels will bleed. And that bleeding will contain around the broken side. And This collection of blood is called hematoma. Hematology means blood, a study of the blood. Hematoma means a group of blood clot. And that blood clot will gradually change into a new bone. So blood clot will gradually become invaded by the inflammatory cells, mast cells, and then finally cartilage cells, and then finally replaced by the osteoblast, osteoclast, and then gradually remodel. So you learn that bones are made of bone cells, matrix. Matrix is made of collagen fibers, inorganic compound, calcium, magnesium, phosphate. And the process of these inorganic compound deposition into the bone matrix is called, what do we call that?
Mineralization?
Brilliant, that's mineralization. Like poor mineralization will give us vitamin D, like for example, like vitamin D deficiency, yeah? Osteomalacia in adult. So if an adult patient got poor mineralization, then that will be called, really will be the answer for the number 12, yes. So that will be poor mineralization in adult is called osteomalacia. Malacia means poor, osteo means bone, poor bone. And in rickets is called in children. So under immature skeleton, it is called ricket. So that's all about the questions for the bone. So now I am going to stop the screen share and I will go to the bone lecture. Okay, bone and skeletal tissue. A bone. So cell and tissue, I think you are bored about this page already. It's too much for you guys. You guys know this easily, even in the middle of the night, 4 types of tissue. And 4 different types of connective tissue proper, skeletal tissue, cartilage tissue, and blood. So don't forget, our blood is a form of connective tissue. And now let's look at the histology slide. And this is what you see with the bone histology. And this is what we call osteon, yeah? Osteon or Haversian system. In the middle of the osteon, there is a small little channel. That is what we call Haversian canal. And the cartilages you can see now. Again, I believe, it is pretty easy for you guys. Because why do you say cartilage? Because it has got cell and matrix. It is not muscle tissue. It is not epithelial tissue. And therefore, it is a connective tissue. I mean, connective tissue proper is something like that. And these are the cartilage tissue. So that is the difference. How can we remember? How do we know? Let's see. I think we have to just try to remember to some extent, keep looking at the slides and then gradually what is what. So the loose areolar connective tissue is a little bit just like, looking from the sky at nighttime to the ground, like little bit lights shedding here and there. Of course, these are cells and fibers are running here and there. Little bit heavy set. So the cartilage tissue, like you can see the cells. These cells are sitting in a little pocket. What do we call these pockets? So these cells are cartilage forming cell because it is a cartilage tissue. And these cartilage forming cells, which are called chondrocytes, and chondrocytes are sitting in the little pockets. That pockets are called lacuna. Yeah, lacuna, Lacuna. And now, why do you say it is a cartilage? Because it looks like connective tissue, and there are cells and matrix, but it doesn't look like connective tissue proper. It doesn't look like bone tissue. It doesn't look like blood, and therefore it must be a cartilage tissue. So now our brain have to think again, what sort of cartilage tissue it is? What sort of cartilage is it? We know that there are 3 types of cartilage tissue: hyaline cartilage, elastic cartilage, and the fibrocartilage. So if you look at fibrocartilage, now you can see the cells here, and you can see the fibrous strands, collagen strands are really coarse. You know, we know that they are running there. It is pretty obvious. Look at the collagen fibers, because fibrocartilage is a tough structure, like the meniscus we saw, like fibrocartilage, which is wrapping the pubic symphysis together. So fibrocartilage is the very tough and strong cartilage, and therefore it needs a very dense collagen fibers, and therefore you can easily see on the histology slide. Of course, that's the way we try to remember. A different slide might be a little bit less prominent, more prominent, but this is the way we try to remember, and this is a very typical slide for the fibrocartilage. These dense connective tissue, like dense fibrous tissue, they are all running, and you can easily see like a storm you are looking from the satellite. And now if you look at the hyaline cartilage is the articular cartilage. So all the joint surface inside the joint, all the bones inside the joint on the joint surface, they are covered by the articular cartilage. Articular cartilage is made of hyaline cartilage. And now you can see the difference. These collagen fibers are, because that articular cartilage is so smooth, it is so pristine, it is so clear, and therefore these matrix are a little bit just like a ground glass, you know. It is not as coarse fiber as this one. So now elastic cartilage is anything to start with E. So ear, epiglottis, so that sort of stuff, ear and epiglottis, these are made of. And now what is more interesting thing is the cells are pretty big. You know, if we zoom in more here, they might be big, yes, but generally, you know, we have the picture like that, and there are more chondrocytes close together. Okay, yeah, here a little bit sparse chondrocyte, one here, one there, one here, one there. And more chondrocytes are well packed together. And with the normal staining, like red and blue, like eosinophil and hematoxylin staining, normal staining, we might not be able to differentiate the elastic cartilage from other cartilage. So we need a special stain to make the elastic fibers, elastin, which is the fibers matrix, which runs in the matrix, elastin fibers, to stain it. That stain the purple color. This is a special stain we need for the elastic cartilage. So now let's move on. So something broken. The blood vessels here exposed. The broken bone is exposed. The big muscle has been torn. The bones and the tissue inside, they are all exposed to the external environment. It is so dirty. This is the trouble. So temporarily, we just clean it, debride it as best, and then we will just fix it from outside temporarily. And now, if somebody asks you what is a bone, the answer is bone is a specialized connective tissue. What is cartilage? Cartilage is the specialized connective tissue. And these specialized connective tissues are made of cell matrix, and inside the matrix, we also have the glycosaminoglycan and proteoglycan. Of course, these are ground substance. So what is a joint? We have studied about joint already. Joint is the junction between two bone surfaces. Easy. And loose areolar connective tissue, this is what it is look like. It is like, looking from the plane up in the air onto the ground, and there are a few lights running here and there, and you can see little red color, and that sort of picture we get. That's the loose areolar connective tissue, which we call lamina propria, which support the epithelial cell. Yeah, epithelial cell need to sit on the connective tissue, which we call lamina propria, which is made of areolar connective tissue. 3 types of cartilages. Now we appreciate a little bit better the fibrous cartilage. Fibers, matrix fibers are running really close, like a Hurricane Katrina coming into the shore like that. And the hyaline cartilage is nice and pristine inside the joint, which give articular cartilage. It needs to be smooth, and therefore its fibers are not coarse, and this like just a ground glass, little pale color, smooth and easy. This is epithelial tissue. Everyone knows it already. This is connective tissue, cell and matrix. And connective tissue is made of cell and matrix. Matrix is made of fibers and ground substances. The ground substance are glycosaminoglycan and proteoglycan. These are just glycosylated protein which attracts the water, and therefore the cartilage, because of the water, it is a little bit bouncy, a little bit cushy, and therefore the cartilage are good to take the weight, and therefore they are designed to coat in the bone, on the bone inside the joint. That is the reason we use it. There is a reason. And fibers could be either collagen, elastin, or reticular fibers. What is collagen? It is an amino acid chain, like 3 amino acid chain just rubbed together systematically. That is an amino acid chain, which is called collagen fiber. Elastin, another amino acid chain. Reticular fiber, it is just collagen, which means the which is the amino acid chain. So the fibers and the cell, yeah. So the cartilage is made of matrix and cell. Cells could be fibroblast, chondroblast, or osteoblast. If we use the fibroblast, we will get fibrous tissue. If we use the chondroblast, we will get cartilage tissue. If we use the osteoblast, we will get bone tissue. On top of this fibrochondro osteoblast, there will be some other cells like fat, white blood cell, macrophages, and mast cell. Cell and matrix, which makes the cartilage. Cell and matrix, which make a bone. That is the formation of connective tissue. So cartilage is specialized connective tissue, cell and matrix, ground substance, and water. So cartilage is also covered by other form of the outer lining, like equivalent to the periosteum. Cartilage is covered, surrounded by the perichondrium. Of course, peri, around, chondrium, cartilage. So now we are seeing different forms of cartilages here, like hyaline cartilage. Hyaline cartilage is the articular cartilage, which covers the bone inside the joint here. Lots of hyaline cartilage. They are so nice, so pristine. Fibrous cartilage, look at that, two pubic symphysis, right and left, being fixed in the middle with the fibrous cartilage. Elastic cartilage here in the ear, look at that, look at that. And the cartilage which connect the sternum to the ribs, which we call chondral cartilage, they are also the hyaline cartilage. Therefore, it is colored with blue, right? So now, if we die, if young enough, then this cartilage will break down and the bone skeleton will remain. And this is a little baby, which is starting with the bone formation. Most of the bones formed by the endochondral ossification. Only the skull bone, which is formed by the intramembranous ossification. Elastic cartilage, if you do not use proper stain, it will be very difficult to differentiate, but usually the cells are much bigger and much closely tagged together. In between the cell, we will have elastic fibers. Elastic cartilage for flexibility and elasticity, ear epiglottis. Easy now, easy. And look at that, our trachea, respiratory pipe or windpipe, which is coming into the thorax, and it's branched into right bronchus and left bronchus. These respiratory tracts, they are made of multiple cartilage rings. It is just like a multiple, like car tires. Like car tires are made of hyaline cartilage rings, one ring after another after another. They are piled together like that. That is the trachea. And trachea, it is also made of hyaline cartilage. You can see the blue color. And this is the hyaline cartilage. Now we can appreciate the matrix, which is nice and clear and smooth and pale and like just like a ground substance. Now you can see the chondrocyte here inside, and chondrocytes are stay within the pockets, which are called lacuna. Hyaline cartilage, it is for flexibility, resilience. We will use for the articular cartilage in the respiratory tract, in the costal cartilage. You have seen this all. And fibrocartilage, now it's just like a Hurricane Katrina, like coming into the shore. We are looking from the satellites. All these fibers are running and very coarse, because fibrous cartilage is the cartilage which has to take the weight and burden and for the force. Therefore, its fibers are coarse and tough. It's easy to see now because these are the typical photographs. And strength and durability, both tension, compression. For example, like articular disc, menisci, intervertebral disc, these are made of fibrocartilage. So this is the meniscus, which we saw in between two bones. Here, knee joint, open it up, and now look inside the articular cartilage, which covers the bone inside the joint. That is hyaline cartilage, and this is meniscus, is our fibrocartilage. So we are using different forms of cartilage in our body to take the full advantage of their property. And now this hyaline cartilage is damaged. And as we know, cartilages, they do not have blood supply. They take their nutrition from the bone by diffusion. They take their nutrition from the synovial fluid, which is inside the knee joint, and synovial fluid will lubricate, make the joint movement smooth, and synovial fluid will seep into the cartilage, seeping into the cartilage, and then that fluid just come out again, in and out of the cartilage. That's the way we have to take the weight and act as a shock absorber. Because if you think about that, these cartilages will last in our body, hey, most of them for the rest of our life. Of course, some people, depending on what it is, you will lose it early. Oh, just 1 minute, guys. Somebody at the door. Just 1 minute, please. I will come back. Okay, so now we have seen hyaline cartilage, fibrocartilage. We are taking full advantage of their properties. Hey, this is what we call physis or epiphyseal plate. This is the epiphysis. This flare region is called metaphysis. And this is the photomicrograph of the cartilage in the epiphyseal plate, this area. And if you look at that, the cells in the base, they are calcified, and different zone, resting zone, proliferation zone, hypertrophic zone, calcification zone. So resting zone means the cells, the chondrocytes are resting there, and gradually they become proliferating, and then they become bigger and bigger, like hypertrophic, and finally they will calcify. And that's the way our bone gets longer and longer.
Is the epiphyseal plate the cartilage itself?
Yeah, epiphyseal plate is cartilage itself.
Okay, so it's just that cartilage that fills in that space for the boxes.
Sorry, did you say that?
So it's just the cartilage that fills in that whole space in the area with the boxes and around that bone.
Yeah, so this all black area is filled with cartilage.
Okay,
so thank you. That is what we call, the endochondral ossification. So like initially the bone is like a cartilage plate, and then finally we got the new bone in the center, in the diaphysis. That is what we call the primary ossification center. And after that, we have another little bone deposit here. That is what we call secondary ossification center. And then these ossification center will gradually form bone, and this became bone. But this remaining area, that is remained as the cartilage plate until we got the bony skeleton maturity. So now the cartilage is gone. You can see that now there is no more cartilage. It might be both, the meniscus is gone, hyaline cartilage is gone. If they are intact, we will have a good space. If there is nothing left, we'll be touching bone on bone, and the bone is seen by the X-ray here. And now in this picture, that little bone at the tip here, the femoral head, does not have any ossification yet. Therefore, it is completely cartilage, and therefore we cannot see on the X-ray because there is no ossification yet. If we have ossification, bang, that's where the starting of the bone formation. Of course, when it starts, it is very small little spot. And then that little spot, bony area, gradually replace the cartilage area and finally become bigger. Still, we still have the cartilage plate remaining, and it remains until we get to the skeletal maturity. So that is the way our bones get longer and longer from these cartilage region. Now we know the cartilage and the osteon. Osteon is for bone, and this is for cartilage. It is very different, isn't it? Osteon is something like the sun ray, like it is just spreading everywhere. Look at that. That is osteon. Here we will say Haversian canal. Inside the Haversian canal, we will have blood vessels and nerve. And here we will have radiation. What are they? We have a look. And here we have little cells. What sort of cell is it? We'll have a look. So yeah, so this is just nonsense, like putting everything in a different proportion, you get different result. So now connective tissue made of cell and matrix, matrix and cell. Now we want to put osteoblast into that connective tissue matrix to make the bone tissue. So bone, specialized connective tissue, easy. And function of the bone is to support movement, protect, storage of calcium and phosphate. That is something we tend to forget about the function of the bone. The bone has many calcium, lots of phosphate, and blood cell formation, energy storage, and energy metabolism. Let's go into bone. And we will classify bone into, depending on their shape, long bone, short bone, flat bone, irregular bone, depending on their microstructure, like compact or cortical bone, or cancellous bone. And depending on mature bone or immature bone. So now the bone shape, long bone, short bone, very irregular shape, irregular bone, flat bone, sternum, skull bone, flat bone. And now, according to the microstructure, compact bone or cortical bone, which is dense outer layer, look at that. This is a dense cortical bone. And the spongy or trabecular bone, which is softer inner layer. Okay, so that's easy. And bone is, of course, bone is connective tissue. What do you expect? You don't expect much. It is made of cell and matrix. Matrix, we have the what do you call that? Proteoglycan, glycoside, aminoglycan, which are ground substance, but not a lot because the bone is more brittle comparing to the cartilage, and therefore we will not have that many glycosaminoglycan or proteoglycan. It is more common in the cartilage. So cell and matrix. Cells, the basic of the osteoblast, the grandpa of the osteoblast is osteogenic stem cell. Of course, that's the DNA. You know, these cells are the basic stem cells that we form bone. From osteogenic stem cell, we change into osteoblast. Osteoblast is the person which makes the bone, which puts bone matrix. And then osteocytes, once the osteoblast, we get we stop functioning or we, then these are called osteocytes, osteocytes. So resting osteoblast is called osteocyte. So which means it's similar. It's just which is working hard and which is resting, that's all. And osteoclast is different. Osteoclast does not start from the osteogenic stem cell. They start from the bone marrow cell. So osteoclast, the job is for bone resorption. Osteoblast is for bone formation. So there is need to be a balance. And if there is no balance, we will have a problem, and that problem is called osteopetrosis, which we have seen in the X-ray. Let's look into the bone matrix. Bone matrix is made of organic and inorganic compound. So what is the difference between organic and inorganic? Organic compound, they have carbon. Inorganic compound, they don't have carbon. So inorganic compound, which are hydroxyapatite, calcium, magnesium, and phosphate. Organic compounds are collagen fibers and ground substances. Collagen fibers, they are made of change of proteins, amino acid chain twist together to get collagen. And that collagen is organic, makes the organic matrix, and in between the organic matrix, there will be gaps, and we cannot have gaps in the bone. We have to fill with something else. So we fill with calcium or magnesium or phosphate or hydroxyapatite. So that is a bone. Osteoblast, bone forming, derived from the mesenchymal origin osteogenic cell, osteocyte, innervative blast, osteoclast, hemopoietic cells origin. They secrete hydrochloric acid, they secrete lysozymes, so cell lysis, and that's the way they remove the bone substance. So bone matrix is made of organic and inorganic compound. Organic matrix is called collagen fibers and ground substances, proteoglycans. Inorganic compound, hydroxyapatite, calcium, magnesium. And the process where we put these calcium, magnesium, hydroxyapatite in between the collagen fiber is called mineralization. So if you do not have enough vitamin D, you will not have enough calcium, you will not have enough phosphate, and that the bone, although they have collagen fibers and poor mineralization, that way makes the bone weak. And therefore the bone will gradually bend. That is a condition called rickets or osteomalacia. Okay, so you guys know mineralization. So now let's get the bone here. Let's get the bone. And then now this is the cross section inside in the medullary canal. We can see the yellow medulla, and we can see the blue articular cartilage here. Okay, articular cartilage. We can see the compact bone, which is made of osteons. So osteons are running in the compact bone, like along the length of the bone. And you can see inner aspect, which is what we call the endosteum. And you have seen the nutrient artery penetrating the periosteum, compact bone, and go into the medullary canal. It is giving blood supplies to the inner two-thirds of the compact bone. Wow. And now we see the epiphysis proximal epiphysis, the shaft diaphysis, and the distal epiphysis. This is a mature bone, so we do not have physis. This physis is this cartilage physis, epiphyseal plate has been removed with the bone tissue, and we can still see the line like a scar tissue, which are called epiphyseal line. Oh, lovely. Right, keep looking at that epiphyseal line. Now we'll see a little bit more like nutrient artery penetrating the cortex and then giving the blood supply here. And look at that, all from this nutrient artery, you know, all the little vessels will run into the Haversian canal of the Haversian system or osteon. Look at that. That is the way we have constructed our bone. Of course, we didn't construct it. We cannot construct a human body. We cannot construct a bone. It is God-given structures. So now we talk about the periosteum. The bone outer surface is covered by a layer of connective tissue. Look at that layer of connective tissue, like a blanket wrapped around the outer surface of the bone. And that is what we call periosteum. And periosteum covers every part of the bone except epiphysis, which is the articular surface. Of course, articular surface need to be covered with the hyaline cartilage because hyaline cartilage is so smooth that makes the glide movement, flexion extension movement of the joint so easy. The friction will reduce because of the hyaline cartilage, which is so smooth. And this periosteum is stuffed connective tissue. It is even thicker in children. An outer periosteal layer and inner periosteal layer. Outer periosteal layer is resist the force. You cannot tension mean bending. You cannot bend. Make sure you know it is strong enough. Inner periosteal layer has got osteoblast, osteoclast. Therefore, it will involve in the bone formation and changing the bone. It is firmly attached to the bone by the Sharpie's fiber, and also periosteum is also very rich with blood supply. So now I have cut the bone in the axial section or cross section, and now we can see the central Haversian canal, Haversian system, which is osteon. We can see the circumferential lamellae and interstitial lamellae. Endosteum, which covers the inner canal of the bone. It is much thinner. Again, like periosteum, it contains some osteoblast, osteoclast. Look at the Haversian canal, Haversian system, and inside the system, you know, all these blood vessels and nerve. And they are going along the length of the bone, and there are crossing nerve and blood vessels. They are running inside the Volkmann's canal. So this is a little bit difficult name, Volkmann's canal. Okay. So now you can see and you can easily identify the Haversian canal. And now you are seeing the lacunae. What do you expect in the lacunae? Of course, you will see, expect some sort of osteoblast or osteocytes in the lacunae, isn't it? Osteocytes will be in the lacunae here because connective tissue, the cells are present and they sit in the pockets of lacunae. Therefore, you can see osteocytes here in the lacunae. And these little fibers, they are running like a sun-like radiation, and they are called canaliculi. Okay. So now I'm going to show you the interstitial lamellae. Interstitial lamellae are just nothing more than collagen fibers running and spiraling around the Haversian canal. So their fibers will be like a zigzag, you know, opposite direction. One is going there, other one is going there. One is going there, other one is going there. So zigzag, zigzag, zigzag. That is the collagen fibers, and these are the interstitial lamellae, which will resist the twisting force. Wow, okay. Now let's look at it. We have seen this picture again and again. Havesian canal might be osteocytes in the canaliculi, and not osteocyte in the lacunae. These are the canaliculi. And bone nutrition. Bone is rich with blood. Therefore, broken bone will bleed a lot. Nutrients, artery, and vein, you have seen it, penetrative form and nutrient format. Bone marking, and the bone is under constant stress if we are standing upright, because it is like the bone femur is this shape. So if we look at the vectors, this is the bending, this is the compression force, and this is the tension force being pulling apart. So the bone is under constant stress, and the form of the bone will follow the function. So most of the things in life, the form follows function. So for somebody who is heavy weighting, running, impact activity, the bone need to be stronger, and therefore the bone density is much better. Therefore, those people who does exercise, especially impact exercise, their bones are much stronger. For those people like who are mainly on the bed, especially those who are immobile because of many different conditions, they are going to lose the bone mass because the bone does not have to take the weight, and therefore they become lazy and they become soft. That's normal, that's life. So the bone is under constant pressure and constant tension. So the femoral head and neck, and that is the way. And depending on the weight, our body as well trying to run the collagen fibers in different direction. These are called trabecular lines. So bone formation, you know that already. Intramembranous and endochondral. Intramembranous directly formed from bone from mesenchyme, skull bone and clavicle. Only two bones you need to remember: skull bone, clavicle, and the rest of the bones, they are endochondral. So let's look at the endochondral ossification. You have a little cartilage plate. That's where you start. That's what your humerus arm bone start. That's what your femur start. And then in this cartilage, there's appear a one little osseous structure, which is what we call primary. So because it is first to happen, primary ossification center. Ossification center mean ossify, mean bone. So in this center, and now we have the little bony structure from the primary ossification center. And into this primary ossification center, the blood vessels will go in and make it develop. So this primary ossification center gradually get bigger and bigger. And now we have a completely bone, no more cartilage in the diaphysis of the bone. And after that, another ossification centers like here or there will turn up because they are second to appear. Therefore, we will call it secondary ossification center. And now, hey, look at that, how clever it is. From here, this bone will gradually expand, and then finally now we got it. We got the remaining articular cartilage, we got the bone, we got the physis, which is growth plate, and this growth plate will stay with us until we got the full skeletal maturity. Like for the boys, it is usually around age 16. For the girls, usually age around 14. This cartilage plate, physis, will open and making new cartilage, and new cartilage will be deposited with the calcium, new bone, and the bone will get longer, and that's the way we gradually grow up. This is endochondral ossification. So now we have it: epiphysis, metaphysis, diaphysis. And I think that was the, oh yeah, so there is one more here, the bone fracture bone. So the bleeding collection of blood is called hematoma. It is a blood clot around the bone. And that is the first step of the bone formation is, bone healing is hematoma formation. And then the fibrous tissue, cartilaginous tissue invade into the hematoma, and finally a new vessels will invade. And then the second stage is called fibrocartilaginous callus formation. Callus means new bone. And finally, the new bone osteoblast will kick in. That is what we call bony callus formation. And finally, after many years, the bone will gradually change shape. That is what we call remodeling. So remodeling takes a long time. So this is an example of osteomalacia or rickets, because this is, we can still see the growth plate. So this is in children. So this is a condition called rickets. There is poor mineralization, poor deposition of calcium, phosphate into the in between the collagen fibers. Therefore, only the collagen fibers are running, and therefore the bone gradually become weak, and then gradually, it doesn't break, but it just cannot take the weight, and then finally change the shape, which is like a bent shape. Defective mineralization. Osteoporosis, it is a reduction of bone mass, both calcium, phosphate, magnesium, as well as the collagen fibers themselves reduce. So the whole bone mass reduced. Now broken or replace it. Cartilage, we know that cartilage. So cartilage growth, appositional growth, and interstitial growth. Appositional growth means more cartilage deposited from outside. Interstitial growth means growth from within. So now we can see the collagen fibers are running. There are holes here, and these collagen fibers are called trabeculae. And look at that, there is a empty space. These space need to be filled with the calcium, magnesium. And now we see this. Now we see this. So that's the end of the bone lecture. Has anyone got any question? Is it too much again? But I believe, because we have a second quote on the bone lecture, at least I feel a bit better. I hope you guys feel better as well, because this is the second lecture on the bone, and we have done the quizzes and we have done the reasoning behind the bone. Of course, there are a few things which we need to remember, and once we remember, we can start reason. Yeah, there is one. Okay. Yes, Doran, it is a lot of information, but hey, we have done it. That's good. We have done it. We have done it. So now, before I let you go, let's do the little short like multiple choice from our canvas, and then I will let you go. I know everyone is tired. Everyone is like 3 days in a row continuous. It's quite heavy. It is quite heavy. So I believe this is from the textbook, nothing new. I believe you know that. I mean, if you look at the textbook again, and then it will be easy for you to answer this question. The same question. Hey, now this is the cartilage plate, which is the physis or epiphyseal plate. So this joint is called enchondrosis. Yeah, enchondrosis. In arthrotic joint, I think this is the easy to study. Synovial fluid is non-Newtonian fluid, which is the ultrafiltrate of the blood plasma. So it's easy. So by plantar flexion of your feet at the ankle joint, you will. So what's happened then? Oh yeah, this is a directional question. On the homework, some of the diagrams are not showing up. Okay. So I think here on the bone lecture, sometimes the diagrams are a little bit heavy, so it takes a time to download. Let's see, thank you. Yeah. So let's check them. So we can see that an example of there is no diagram. So what is a good example of ball and socket joint?
The humerus.
Eh?
The humerus.
Yeah, humerus. Yeah, between glenoid and the humerus, glenohumeral joint or shoulder joint. Another joint is like a hip joint, isn't it? Hip joint is ball and socket joint. This is kyphosis. So I think the diagram here are okay. I'm not sure why they disappear sometimes. All right, so it should be easy for you guys. Okay, has anyone got any question? No. Shall I let you go? Yes. Somebody said no. They want to continue with lecture. All right. I'm going to stop recording.